It's definitely an easy thing to place and remove. And you have it in the toolkit, so then it's easy to say to a patient or the family, let's try this, see if this works well for you, if you're comfortable with it, and if you find that your general comfort is doing better with us giving the medications that way. People, I think, appreciate that it's an easy thing to try and an easy thing to maintain. The experience I've seen is that if a patient is initially reluctant, later on they say, well, maybe we better try that. And then they're usually sold on it once they try it. They say, this is actually helping out quite a lot. It also really helped me to have an avenue for giving medications that wasn't about poking the patient, doing an IV, or something else that would potentially be cause more discomfort, or that they would pull out. It's easy to give them medication and keep them comfortable that way. With so much of this, we're trying to meet our patients where they are, and as best we can help them stay home. But we're in an area that's, it's quite spread out. And for some of these patients, it's, not just distance. Some of them, it's distance and windy roads or even dirt roads. And to be able to give them the tools they need to manage things at home is really helpful. By and large, there's most patients and families, once the patient tries it, everything's going well, and they like it. We can teach the family how to manage the catheter, and it's definitely a nice thing to give patients a little and their families a little better self-sufficiency. So I have about 25 years practicing physical medicine and rehabilitation, and most of that's been inpatient rehab, and a lot of my patients have had dysphagia from strokes and other conditions. And a lot of times when somebody has a significant dysphagia from an acute stroke, if they're not able to swallow safely, especially if they're not up and real mobile in those early days of the rehab, sometimes we're trying to figure out, is this swallow likely to get better soon? And how do we get medication into the person? For some medications to have the option to do through the Macy would have been a very valuable thing. Especially knowing that you also have that avenue for hydration would be helpful, because sometimes you're in a setting where you can get an IV in and do hydration that way, but sometimes to be able to hydrate somebody or rehydrate somebody via the Macy Catheter would be a helpful option. Some patients are getting relatively dehydrated and not particularly uncomfortable with it, and that's okay as you're getting close to the end. But there may be some patients who are wanting to, let's say blood pressure's dropping, but so-and-so's coming to town to visit, and they really want to make sure that we're helping keep your pressure up. That's a patient that maybe we would want to rehydrate. And then in rehab, again, the patients where having their blood pressure drop, which can potentially exacerbate the symptoms of the stroke, would be a bad thing. And so, again, sometimes we're giving IV fluids for those patients, but to have the option of doing it by rectum would be a helpful thing. Some patients will pull out their IVs, and the last thing you want to do is make the patient feel even worse by restraining them if you can help it. And so if the patient doesn't tolerate an IV, but they do tolerate the Macy catheter, then sometimes it would be trial and error to see which they would do better with. But I could easily see that some patients would do better with the Macy.